Hi, welcome back to Antai Hospitals YouTube channel, and today we'd like to directly dive into an important discussion on hysterectomies and why you shouldn't uh, willingly or always get a second opinion before you go for such a drastic procedure. Since the establishment of Antai Hospital, we've always held a very strong position on hysterectomy. Our philosophy is that you should avoid it, only go for hysterectomy if it's necessary. And we will discuss the situations that require a hysterectomy. But nowadays, especially in the United States and parts of Europe, Asia as well, it is widely being recommended for women with all sorts of treatable benign conditions, especially at Antai Hospital, where we can effectively treat it without removing the organ and allowing you to achieve your fertility goals, which is natural pregnancies. These are all achievable. However, women are not being educated, they are not aware of the potential lifelong consequences, side effects, and they're not aware that there are hospitals out there that can effectively treat their condition without hysterectomy. It is so widely recommended that this is the second most conducted medical procedure in the United States, with at least 600,000 procedures done per year. So, at Antai Hospital, we only recommend hysterectomies under two specific situations. So, firstly, we only recommend hysterectomy if the underlying medical condition of the patient is a malignant one, it's cancerous, and it's spreading fast in the reproductive region. And if it's affecting the uterus, then we need to immediately go for either a partial or a complete hysterectomy. That is unavoidable. That is situation one. Situation two is a life-threatening factor, which means this patient's medical condition involving the uterus is potentially life-threatening. If not conducted, the patient may lose her life. Then we need to immediately go into either a partial or full hysterectomy, non-negotiable for these two conditions. Any other medical condition, you can actually effectively have it treated using either hysteroscopy or laparoscopy, especially in competent, experienced medical institutions with expert doctors. They can have it done for you, and you can achieve the benefits and also your fertility goals without losing such an important organ such as the uterus. We are making such videos because we are seeing many young women go for unnecessary hysterectomies just because their doctors have recommended it. Now at the age of 25 or 35, they've already lost the ability to menstruate, lost the ability to bear a child, and they're also carrying lifelong side effects. These are all affecting their quality of life, and they also affect societal and familial relationships around them. It is, in fact, a far-reaching situation. It doesn't affect the patient alone, it can affect everyone around her. So, besides those two conditions that I've mentioned, any other situation or medical conditions, for example, adenomyosis and endometriosis, these two conditions are so commonly recommended hysterectomy that it is mind-boggling for us here at the hospital. These two conditions are fully able to be treated because, first of all, they are not malignant, and with the correct doctors, the correct expertise, and the experience, they are easily treatable with high success rates, low recurrence. You don't need to lose an important organ like the uterus. You can still go on to have regular, healthy menstrual pain without any debilitating menstrual pains or pelvic pains or abdominal pains. All of that can be treated, and you can achieve a healthy pregnancy, because that is our priority here. We want to avoid unnecessary uterine removals, avoid unnecessary castrations, keep the uterus if you can. If it's not cancerous, if it's not life-threatening, avoid it, and seek specialist hospitals such as Antai Hospital to have it treated properly. We can guarantee you quality of life can be restored, because many of these times these patients are having severe menstrual pains, cramps, pelvic pains, all caused by these diseases. If they are properly treated, then you can actually enjoy a better life, and hysterectomy is not the solution. So this video is short and sweet, but the conclusion is that before going for such a drastic procedure as a hysterectomy, please seek a few more medical opinions, few more doctors' opinions, and do more research or hospitals that can actually treat it. Antai Hospital does treat these conditions regardless if it's endometriosis, adenomyosis, uterine fibroids, pelvic inflammatory diseases, and other diseases of the reproductive system that usually doctors will recommend hysterectomy. We can have it treated without the removal of the uterus, and your life quality will be restored, and your ability to have natural pregnancies can be restored as well. Hysterectomy is not the final solution. Usually it's the more shortcut solution and unnecessary solution. That is why we are very disappointed and we are very worried that many women are just willingly going for these types of procedures. They are non-reversible and carry lifelong side effects. So I hope that this video helps you in your decision making, and if you really want our help at Antai Hospital, if you are suffering from any of the diseases that I've mentioned, especially if you have severe pains as well, get in touch with us as soon as you can. We can help you today to achieve your fertility goals and restore quality of life for you. Stay tuned to the next one.